Hello friends, welcome back to my channel. Myself Dr. Rosie. So in the previous video, we discussed the types of incontinence of urine. Now we will discuss the management and treatment part. To manage and treat any kind of disease, we should know the probable causes of the same. So let's now discuss the causes one by one. One of the most common cause of incontinence of urine is weakness of urinary bladder and weakness of pelvic floor muscles, which is usually associated with the prolapse of anterior vaginal wall. So next cause is weakness or spasm of urethra sphincter, due to which patient loses the holding power of urine. Whenever patient has a strong urge to urine, or she laughs, or cough, or sneeze, the urine escapes out. Next cause is recurrent urinary tract infections or chronic cystitis, which is associated with the urge incontinence of urine. Cause is pregnancy. So in the first trimester, there is an increased frequency of urination as the uterus is enlarging. So if the patient has already a weak bladder, there is chance of urine leakage. Patient gets relief in the second trimester as the uterus straighten up. Again in the third trimester, there is increased frequency of urination due to pressure of fetus head on the bladder. Next cause is menopause. As the estrogen hormone helps to strengthen up and gives tone to the bladder, in the menopause there is chance of urinary incontinence, especially if the patient has multiple normal vaginal deliveries. Incontinence of urine is also common after difficult or obstructed labor. Some studies show connection of vitamin D deficiency and incontinence of urine. Other causes are constipation, huge ovarian cyst, or stress, etc. In males, it is common in enlargement of prostate gland. Next comes the management part. Cranberry juice helps in urinary tract infections. Weak bladder and weak pelvic floor muscles can be managed by Kegel exercises. Patient must avoid bladder irritants like caffeine or smoking, etc. Vitamin D3 and omega-3 fatty acids helps in reduction of inflammation. Clinical diagnosis can be made by asking the patient to cough or by per speculum examination to see the anterior vaginal wall prolapse. Then urine routine examination can be done to detect the urinary tract infections. Weak bladder can be detected by ultrasonography for residual urine. Next comes the treatment part. These remedies are useful in stress incontinence. In weakness of bladder, causticum, alumina and pulsatilla works very well. These homeopathic remedies are very useful in urinary tract infections. For urge incontinence, we have cantharis, Paris quadrifolia, Staphylococcus aureus, sulfur, Hedioma, Squilla, etc. So for overflow incontinence also we have many homeopathic remedies. Postpartum complications can be managed by arnica, arsenic and causticum, etc. There are indications of few more remedies in homeopathy for incontinence of urine. Just remember, homeopathic treatment differs from case to case. You can get the link of previous video in the description box below.